I'm Dr. Jessica Frankenhoff, and I'm here to talk about DeQuervains Tendonitis. DeQuervains Tendonitis is a tendonitis at the base of the thumb. The symptoms include pain with writing, pain with twisting of the wrist towards your pinky, and pain with bending the thumb down. And the pain is localized right to this area on the thumb side of the wrist. It's very common in new mothers. Picking up the baby multiple times puts a lot of strain on that tendon. Hairdressers often get the tendonitis from cutting all day, but pretty much anybody can get it. You can even get it from a trauma. Throwing a heavy pocketbook over your shoulder can extend the thumb and cause inflammation of the tendon. What we do for that is splint the thumb and the wrist in something called a thumb spica splint that will immobilize the thumb and the wrist, and the tendons can calm down. That and anti-inflammatories. Therapy can also be used. A topical steroid can be put on the skin, and the therapist will use something called iontophoresis to get the steroid into the tendon. And finally, the quick solution, and that is usually the first treatment that we offer, is a steroid shot into the tendon. And that usually gets rid of the tendonitis about 80% of the time. We also encourage people to use the thumb spica splint continuously for another couple of weeks after the steroid shot. And finally, if those modalities do not cure the tendonitis, there is surgical intervention. And basically, the tendons underneath the ligament are getting stuck under the ligament, and the more they try to pull under the ligament, the more inflamed they get, and more inflamed that ligament gets. So the surgery is simply cutting a ligament. It takes about 10 minutes. There's very little downtime after the surgery, and the recovery is about 2 weeks before the stitches are removed. If you have any questions, please give us a call. Thanks.